national collaboration for malaria elimination in Nigeria. In fact, Lagos is a typical case of urban malaria, with area with very low transmission coexisting with hotspot, which is, I believe, something this project aims to address. Lagos State has made remarkable strides in malaria control, maintaining low prevalence since 2015. However, high transmission in selective LGAs remain a concern, requiring sustainable attention and intervention. To prevent setbacks, it's critical to maintain targeted, evidence-based interventions tailored to the unique epidemiological landscape of Lagos State. The recent ministerial dialogue on malaria played a vital role in re-engaging stakeholders and reaffirming the government's commitment played a vital role in re-engaging others and reaffirming the government's commitment to addressing this long-standing public health challenge. Let me take this opportunity to provide some critical highlights. According to the World Malaria Report 2024, Nigeria accounts for 27% of the global malaria cases and 31% of malaria-related deaths. In response, the Coordinating Minister of Health and Social Welfare is committed to reducing malaria transmission and outlined a 9-point action plan to accelerate progress toward achieving national targets. Expanding and consistently implementing effective intervention across all states with strong partner support is indeed imperative. Furthermore, new cost-effective strategies must be adopted while ensuring access to quality malaria prevention and treatment services. The extensive private sector presence in Lagos presents a valuable opportunity for collaboration. This project is particularly promising as it seeks to bridge public health partnership gaps and strengthen community engagement. Aligning this initiative with Mr. President's agenda on unlocking the value chain will enhance local market and foster strategic partnership for improved population health outcome. I would like to really take this opportunity to thank the World Bank for believing in us to be the grantee for this very important project. And I'd like to thank our collaborators, our partners, our implementing partners who are involved in this program, MyShamed, FSH, and others from the government and the private sector. We will provide, and we are committing, will provide the technical expertise to ensure the successful execution of set objectives and contribute to the sustainable pathway for malaria pre-elimination while strengthening public-private sector collaboration for further improvement on malaria case management. We will provide technical assistance to ensure that only true malaria cases receive medication. The project will provide valuable insight on malaria diagnostic accuracy, proper use of anti-malaria drugs, and use of digital tools in private and public health facilities. The experience gained from this project will inform policies to improve fever case management and malaria control, particularly in Lagos State. WHO will closely work with the Lagos State Ministry of Health to use the best practices and lessons learned for further improving the integration of health service delivery and reducing the burden of other priority public health. In conclusion, and I'd like to emphasize this, malaria has been close to my heart. In the over 35 years of my experience with public health, over 20 I spent in WHO. And over those 20, 80% was on malaria, including our latest attempt to stop artemisinin resistant continent. Malaria will remain in my heart. So we will continue to be engaged for a significant step forward toward malaria elimination in Lagos. With sustained commitment, strategic partnership, innovative approaches, we can accelerate the progress toward malaria-free Lagos State and Nigeria at large. WHO remains committed to supporting the design, the implementation, and the evaluation of this initiative in alignment with the governor's health agenda. Thank you again for making WHO part of this initiative. We will obviously be part of the success story that will unfold. Thank you again for your attention in this particular initiative. Thank you.
Your Excellencies, distinguished guests, ladies and gentlemen, I'm sure we can do better than that. That was the goodwill message of the country representative of the World Health Organization in Nigeria, Dr. Kazadi Mulombo. Thank you very much. The Honourable Minister of Health, Honourable Minister of State for Health, who is standing in for the Honourable Minister of Health and Social Welfare, members of the Lagos State Executive Council, especially our host, the Honourable Commissioner for Health, Professor Akin Abayomi, as well as the Special Advisor to Mr. Governor on Health, Dr. Mrs. Kemi Ogunyemi. We also have some other ESCO members that have joined us here already. We also welcome body of permanent secretaries in the Lagos State Public Service. Let me single out the Permanent Secretary, Ministry of Health, Dr. Olusegun Ogboye. Let me also welcome the brand new attendee at the Nigerian Institute of Policy and Strategic Studies, who now has the fiat to add MNI to his title, the Permanent Secretary, Dr. Ibrahim Mustafa, Lagos State Primary Health Care Board. You're welcome, sir. Distinguished guests, let me, with your kind permission, also welcome the World Bank country representative in Nigeria, Dr. Ndiame Diop. You are very much welcome. Thanks for joining us. We also welcome specially the Honourable Commissioner for Finance, Mr. Yomi Oluyomi. You are very much welcome. I have also seen the Commissioner for Women Poverty Alleviation, this Mrs. Dada. You are very much welcome, ma. With your kind permission, distinguished guests, ladies and gentlemen, as we await the arrival of the special guest of honor, our pride, the award-winning governor, and the shining example for other governors in Nigeria, the governor of Lagos State, Mr. Babajide Olusola Sanwo-Olu, as well as his deputy, let me once again welcome every one of you all to this program, which is tagged Pathway to Malaria Pre-Elimination and Digitization Program in Lagos State. We all know very well that Mr. Governor accords health a prime place in his administration. When he was sworn in over close to 6 years ago, his administration was anchored on the themes agenda, which later became the Themes Plus agenda. The second pillar of that themes agenda is health and environment. And under health, Mr. Governor is adequately committed to preventive health care. That is why when we talk about malaria here today, we know that Mr. Governor and his administration has done a lot for residents. Are we going to talk about provision of mosquito nets? Are we going to talk about all the medical missions that we've organized around local governments and local council development areas where people are tested for different ailments and diseases such as malaria? They are given prescriptions, and the state government also follows up on such people so that we ensure that they return to perfect well-being. Can we please appreciate our own pride once again? Distinguished guests, ladies and gentlemen, like I said, I am not here alone. My own name is Kunle Adesina. I work with the Lagos State government. Co-anchoring this event with me today will be Abiodun Oloyede. Abiodun, if you step forward and say hello to some of our guests. We will be expecting some other ESCO members from sister states, such as Ekiti State, Ogun State. We'll be expecting the Honourable Commissioner for Health from Ekiti State, Dr. Oyebanji Filani, as well as his Ogun State counterpart, Dr. Tomilola Koka. Let me hand over the microphone to Abiodun Oloyede.
Thank you very much, Mr. Kunle Adesina. Please, can we put our hands together for him, ladies and gentlemen? Thank you very much. Very quickly, we want to acknowledge the presence of, although he just gave a speech to, the country representative for World Health Organization in Nigeria, Dr. Walter Kazadi Mulumbu. Please, can we put our hands together for him? We are also specially acknowledging the presence of the country director, Bill and Melinda Gates Foundation in Nigeria, Uche Amaonwu. Please put your hands together for Uche Amaonwu. We want to specially acknowledge the presence of the Chief Executive Officer, GMD, Society for Family Health, Dr. Omokodu Idogo. Please put your hands together for Dr. Omokodu. We are acknowledging the presence of the Registrar, Pharmacy Council of Nigeria, Pharmacist Baba Shehu Ahmed. We want to specially also recognize the presence of Dr. Michael Charles, is the CEO, RBM Partnership to End Malaria. Please put your hands together for him. Thank you very much. We want to specially acknowledge the presence of the newly elected president of the Healthcare Federation of Nigeria, who have been a very strong and wonderful supporter for this program. Ladies and gentlemen, put your hands together for Mrs. Njide Indili. Thank you very much, ma'am, for coming. We appreciate your presence. We also want to specially acknowledge the presence of the Vice President, African Healthcare Foundation, Claire Omasheye. Please put your hands together for her. Thank you very much, ma'am. We are very grateful for your presence. In our midst, too, we have the Chief Executive Officer for Maisha Meds, Dr. Jessica Vernon. Please put your hands together for Dr. Jessica Vernon. We are grateful for your presence, ma'am. We want to specially acknowledge the presence of Dr. Ndiame Diop, the World Bank Country Director. Please put your hands together for Dr. Ndiame Diop. I think will also join us. Thank you very much. We are very grateful. Quickly, we want to acknowledge the presence. Oh, thank you very much, sir. We are very grateful. We appreciate your presence. We want to specially acknowledge the presence of Professor Wellington Oyibo of the Center for Malaria Diagnosis, Research and Capacity Building and Policy, University of Lagos. Please, can we put our hands together for him? Thank you so much, Prof. We are very grateful for your presence. We acknowledge the presence of Dr. Nnenna Obulafo, the National Coordinator for NMEP. Please, can we put our hands together for her, ladies and gentlemen? We want Nigeria's National Malaria Elimination Program. We presence. Also, very quickly, we want to acknowledge the presence of the Permanent Secretary for the Ministry of Health, Dr. Olusola. Ogboye, please can we put hands? Ogboye, we are very grateful for your presence. Thank you very
much. Minister of State for Health, Council, all other courtesies duly extended. Permission also inform every one of us all that the Ministry of Health, Social Ministry, it is the only ministry that boasts of 10 permanent secretaries. 10 permanent secretaries, yes. It's a unique. Let me, with your kind permission, the other permanent secretaries, because districts that are manned by very capable permanent secretaries. Let's welcome the Health District 1, Dr. Olufumilayo Bankole. You are very much welcome. Welcome the Permanent Secretary, Health District 6, Dr. Abimbola Mabunje. We also welcome the Permanent Secretary, Health District 2, Ayo Lajide. Let me also, with your kind permission, welcome the Secretary, Lagos State Health Management Agency, LASHMA, Dr. Emmanuel Zamba. As more of our permanent secretaries arrive, we will recognize them. But once again, let me also welcome the Permanent Secretary, Ministry of Health, Dr. Olusegun, as well as his counterpart in the Health Service Commission, in the Lagos State Board, Dr. Ibrahim Mustafa M. Said, we are here gathered for a symposium titled Pathway to Malaria Pre-Elimination and Digitization Program in Lagos State. It's about charting a way forward to make it better. The state government is doing a lot in this area, and I'm sure at the end of our gathering here today, more pathways will have been created to ensure that malaria is permanently permanently banished from Lagos State. Can we please appreciate the Center of Excellence once again? Mrs. Cecilia Babajide is the Honourable Commissioner, Women Affairs and Poverty Alleviation, the WAPA Ministry. You are very much welcome, ma. Mr. DJ, if you can give us a very light tune, because in a very short while we are expecting the special guest of honor, Mr. Governor, to arrive for the formal commencement of this program.
Distinguished ladies and gentlemen, for the next goodwill message, ladies and gentlemen, I want to specially welcome the newly elected president of the Healthcare Foundation of Nigeria, Dr. Njide Ndili, for our goodwill message. Please, can we put our hands together for her, ladies and gentlemen? Thank you very much. Please, we can make it better, we can make it better, we can make it better. Thank you.
Good morning, everyone. Your Excellency, the Executive Governor of Lagos State, ably represented by Professor Akinyemi, Your Excellency, the Minister of State for Health, Dr. Salako, and permit me to stand on already established protocols. As you heard him, I'm the newly minted President of the Healthcare Federation of Nigeria. The ceremonies just took place over a couple of days ago. So for those who don't know, the Healthcare Federation of Nigeria is the advocacy body for the private healthcare organizations in Nigeria. We speak with one voice, and our objective and mission really is to support government to create a better healthcare system for all of us. During the ceremony, the chairman of Farm Access, who happened to be the lead initiative of the World Bank, Professor Camargo, made one comment which stuck with me, that Africa will not achieve its healthcare objectives of UHC if public and private don't work together. Neither can succeed while functioning in isolation. So that is really the Federation. I've been there from inception. I helped craft the strategy. Lagos State is a state that we've also supported. So this is a very important program dear to my heart. We're a second cap as the country director of Farm Access Foundation. We have supported Lagos State and many of its agencies to improve the healthcare system, the delivery, the health insurance programs, and so on and so forth, improving the quality of care. So I think that we will find a way to link into this program because our philosophy is that we should minimize the verticalization of programs and find a way to horizontalize them so that we as development partners that have funding and support that we can give can integrate and start off where there are gaps, fill in the gaps, or find a way to extend what has already. Much looking forward to seeing how this program, how the Healthcare Federation or Farm Access can take it to other states so that the benefits are nationwide rather than just in Lagos. Thank you very much, and I'm pleased to be here.
Thank you very much, Mrs. Njide Ndili, the President of Healthcare Federation of Nigeria. Very quickly, ladies and gentlemen, for the next
this evolving opportunity, one both as part of this initiative, the impact, and we feel so to thank engagement to ensure that this leadership that Lagos is committed to truly happen. We are proud to be associated with all our partners here under the National Malaria Elimination Program, the Pharmacy Council of Nigeria, the Andy Center of Excellence, the World Health Organization, and of course the World Bank for providing this. Let us continue to decisive step towards a malaria-free Lagos and ultimately a malaria-free Nigeria. Lagos, I thank you for your leadership.
Thank you very much, Dr. Omokudu. Without wasting any of our time, distinguished ladies and gentlemen, I want to specially welcome the Vice President, African Healthcare Federation. Ladies
as well as Lagos role, provision of commodities to strengthening logistics support of pharmaceuticals, long-lasting insecticide-treated nets, to capacity, working alongside Lagos State Government and the federal, also leveraging on the use of digital tools to get access to make more informed decisions. Making a difference. When Lagos gets it right, Nigeria gets it right, Africa gets it right. We believe that collaboration is the new innovation, and therefore collaborating with the private sector will be able to make a difference in this elimination process. I wear a second hat as the MD of JNC and a partner to out-diagnose also provision of RDT alongside the Lagos State Government to make a difference towards this elimination objective and strategy. Thank you very much.
Thank you very much. Please can we put our hands together for Claire Omashaye, the Vice President, African Health. Lagos State leads and others do what? Lagos State leads and others do what? You get it? If you don't get it, you're doing well. Please put your hands together for yourselves, ladies and gentlemen. Very quickly, coming up stage now, ladies and gentlemen, is the Director, in the University of Ibadan Research Foundation. Ladies and gentlemen, please let's put our hands together for Professor Olusola as he comes for the goodwill message. Please can we put our hands together for Professor Olusola? Put your hands together for him, ladies and gentlemen. Thank you very much. And please, may I kindly announce that the protocol has been established already, so please, we are working with time and we want to specially request that we keep our goodwill messages short and brief. Thank you very much.
Thank you. The Executive Governor of Lagos State, the State Minister of Health, the Commissioner for Health, if Nigeria gets it right, Africa will benefit. The components you brought together on the pre-elimination are components that thousands worked on across the world. And the opportunity of Professor Abayomi working with the World Bank, WHO, and other organizations to make this possible is the unique nature of Nigeria taking advantage of what is an adversary to the country. If we can continue with this, I also spoke with the commissioner about it. We need to turn malaria into economic advantage. In 2023, 900,000 diagnoses were reported. That is less than 70% of the malaria cases in Lagos State. You can imagine with this impact project and our partnerships, you start producing non-invasive diagnostics and you sell it between 500 and 2,000 naira. That's over 1.8 billion naira a year. Let's make advantage and take advantage of the disease. I take this to congratulate you and all the people who are working with you and wish you success with this initiative. Thank you.
Thank you very much. Please let's put our hands together once again for Professor Olusola, the Director, University of Ibadan Research Foundation. We are very grateful, sir. Coming next for the goodwill message is Dr. Funke Fashawe. Dr. Funke Fashawe is the Country Director, Clinton Health Access Initiative, CHI. Please can we put our hands together for Dr. Funke Fashawe as she makes her way to the stage for the next goodwill message. Thank you very much. We can make it better, and as soon as she's done, please, pharmacist Babajide Mohammed, you'll be coming up next, so please kindly get ready, sir. Thank you very much.
All right. Good morning, everyone, and all protocols duly observed. My name is Funke Fashawe, Country Director, Clinton Health Access Initiative, as well as Vice President of Integration globally. I would also like to join everyone to congratulate the Lagos State government for this exciting development in the malaria space. As many of you might be aware, Clinton Health Access is a global health organization, and a lot of what we do is around leveraging the private sector to create markets that make services more affordable including making access to commodities and diagnostics cheaper for governments to be able to provide care to their people. We've worked in Lagos State for over 10 years, and we've continued to support the Lagos State government in malaria, as well as several other program areas. So we're extremely excited about the initiative, and we do hope that this effort leads to improvement in surveillance and, of course, elimination of malaria in Lagos and in Nigeria as a whole. Thank you very much.
Thank you very much, Dr. Funke Fashawe. We are very grateful for that very brief goodwill message. Coming up next, ladies and gentlemen, is the Registrar Pharmacy Council of Nigeria, the very wonderful pharmacist Baba Shehu Ahmed. Please can we put our hands together for him, ladies and gentlemen. This is the Registrar Pharmacy Council of Nigeria, and they are very key partners in this event. Thank you.
Good morning, the Honourable, Your Excellency, the Executive Governor of Lagos State, the Honourable Minister of State for Health, the Honourable Commissioner for Health, Lagos State. Permit me to stand on the existing protocol already laid out. PCN is a partner in this project. I may not be able to take all that I have as goodwill because of time. But let me say that I stand here to bring the very warm compliment of the management and staff of the Pharmacy Council of Nigeria to the Lagos State government, particularly His Excellency, and then the driver of this project, who is the Honourable Commissioner of Health, on this official launch of Pathway to Malaria Pre-Elimination and Digitization program in Lagos State. We strongly ally as PCN, being the regulator of the private sector players in this particular project, the community pharmacists, as well as the patent and proprietary medicine vendors. We align strongly with the commitment of the Honourable Commissioner of Health. I say this because we had a pre-engagement meeting in his office together with the World Bank and other partners, and we saw clearly the commitment to achieve the noble objective of this goal. And we can see clearly that that commitment is a clear demonstration of the leadership of the state under His Excellency, the Executive Governor of Lagos State. Having said that, you will find in us, as Pharmacy Council of Nigeria, a very committed as well partnership, more than ever before, because we are currently riding under the very strong stewardship of the Federal Minister of Health, under the leadership of the Coordinating Minister of Health and the Minister of State for Health, who, in their own wisdom, are currently driving this sector through the health sector renewal agenda. And topmost on that agenda, of course, is governance. And in that governance structure is the strengthening of the regulatory agencies, which, of course, the PCN sit very well in there as the regulator of pharmacy, with responsibility for regulating the training, the practice, the education, as well as the all premises in this particular sector. I'm talking about the community pharmacies, as well as the patent and proprietary medicine vendors. On this note, I want to congratulate His Excellency, and I want to say this through the Honourable Commissioner of Health again, for Lagos taking the leadership initiative to champion this cause. As a regulator of the workforce on the pharmaceutical sector, PCN, like I said, is poised to bring its regulatory standards to participate and guide this particular project, as well as ensuring that the lessons learned will definitely be translated into the continuous training of the professionals. I'm talking about the mandatory continual professional development program for the pharmacist, as well as the continuing education program for the patent and proprietary medicine vendors. We congratulate Impact and assure you that as regulators, we will provide all the necessary support and guidance. Thank you very much.
Thank you very much, ladies and gentlemen, for putting your hands together for the Registrar Pharmacy Council of Nigeria, Pharmacist Babajide Ahmed. Up next on the list for the goodwill message is the Chief Executive Officer, RBM Partnership to End Malaria, Dr. Michael Charles. Please come put your hands together for Dr. Michael Charles as he comes for his goodwill message. Thank you very much. Please, we can make it better, ladies and gentlemen. Thank you very much.
Good morning, Your Excellency Executive Governor of Lagos State, ably represented by Professor Abayomi, the Minister of State for Health. Allow me to stand on existing protocols and say good morning. My name doesn't do justice to my heritage, so I will reintroduce myself. My names are Michael Adekunle Charles, a proud citizen of Nigeria and of Lagos State. And to also say that my sister is one of the permanent secretaries of Lagos State, Dr. Babajide. She's number one, I'm number last, the fifth. But really it gives me great pleasure to stand here in front of all of you to congratulate a state that I'm highly proud of. I attend many global meetings in my role as the RBM Partnership CEO. And I cringe every time I hear Nigeria being stated as the country with the highest burden of malaria. I also stand elevated when in the second sentence we hear we have political will, we have strong will, we have a minister that is really credible and is doing everything possible. And I'm also happy that the next meeting I go to, I will definitely say that Lagos State is also on the path to pre-elimination, and we will continue to make Nigeria proud in everything that we do. But allow me from a global perspective, pre-elimination. We've seen countries that were declared just last year. Part of the success, one thing that they did was really ensure to embrace a whole of society, a whole of government approach. When it comes to malaria elimination. What do I mean by that? We need to see malaria not just as the responsibility of the health sector, a responsibility of every single sector within government. Be it education, be it gender, be it poverty, be it development, be it everything. Malaria has a key role to play, and I think we need to continue to embrace that. A country like Uganda actually has a policy that every single ministry needs to have a component of malaria. In the fight against malaria, everybody needs to be part of it. So I think a whole of government, a whole of society approach is needed. The second thing is the partnerships. It's really, really important that we continue to embrace public-private partnerships in all its dimensions, because that's the only way towards elimination. So on this note, I really congratulate the Lagos State government. I congratulate Nigeria for all its efforts, and really looking forward to working together with you. From the RBM partnership perspective, we will continue to stand with you, we will continue to work with you, and we will ensure that we continue to profile Nigeria as a country of excellence and Lagos State as the center of excellence. Thank you very much.
Thank you very much, Dr. Michael Adekunle Charles. I hope I'm correct now, sir. Thank you very much. He's the CEO of RBM Partnership to end malaria. Coming up next, ladies and gentlemen, for his goodwill message is Dr. Ndiame Diop, the country director for World Bank in Nigeria. Please, can we put our hands together for Dr. Ndiame Diop, ladies and gentlemen, as he comes for his goodwill message. Please, let's make it bigger. Let's make it bigger. You know, when you see a sponsor of an event, you make it very big for them, so they'll be encouraged to do more. Thank you very much, Doctor. We are very grateful for your presence.
Thank you very much. First of all, warm greetings to His Excellency, the Executive Governor of Lagos State. Greetings also to Honourable Minister of Health, my good friend Pate, who couldn't make it today. But I would like also to warmly greet the State Commissioner of Health and all partners and friends that are here. I will stand on existing protocol. So my message will be very short. I think we know the problem. I also think we know the solutions. There is strong political will in the state of Lagos. There is a strong commitment to pre-eliminate and even eliminate malaria in Nigeria. There is a very strong partnership with the private sector, but also with development partners. I feel that everyone is committed to really achieve this goal, which is extremely important for the future of Nigeria. I guess what we need to focus on is really to implement all the policies, including this very sensible and fit-for-purpose initiative, which the World Bank is very, very proud to continue supporting. So I think the future of Nigeria is tied to the human capital of its children. And I was struck by a couple of statistics that I saw recently. Number one, 30% of under 5 mortality is caused by malaria. 60% of outpatient visit to health facility is for malaria. And 95% of treatment of malaria is out of pocket. I think these 3 statistics, in my view, summarize the scope of the problem. And there is no reason for Nigeria, which is the, as we call it, the giant of Africa, the largest economy in PPP terms in Africa, a country full of talent and people that know how to solve this. There's no reason for this to prevail. So I would like to really express our enthusiasm and confidence that the commitment we see here, the political will of the governor, and the work of everyone, including the strong partnership with private sector, will get us there. And the World Bank will continue to support this initiative and will deploy every effort to really contribute modestly to its success. I would like to thank and commend the State of Lagos, the Ministry of Health, and the State Commissioner of Health in Lagos State for the very strong partnership with the World Bank. I'd like to also thank all the partners in the private sector and in the development community with whom we've been working on this initiative. I really am confident that Lagos will be among the first states, perhaps in Nigeria, to eliminate malaria. And I think when Lagos does so, it will have rippling effect in the country. and the rest of the continent. Thank you very much.
Thank you very much, Dr. India Diop, the Country Director for World Bank in Nigeria. We are very grateful. Coming up next. Okay, ladies and gentlemen, we are made to understand that very soon we'll be receiving the Governor of Lagos State, Mr. Babajide Olusola Sanwo-Olu, and as soon as he comes in and is seated, we'll have the national anthem, then we'll move on with the order of program, and we'll start with the goodwill message from the Executive Secretary, Country Coordinating Mechanism of the Global Fund, but that will be as soon as we're all seated after the national anthem. I'll hand over to Mr. Kunle Additional to take us further. Thank you very much.
The Honourable Minister of State for Health, Federal Republic of Nigeria, all other courtesies duly extended. Let me also welcome the Executive Secretary, a farmer, Dr. Abiola Idowu. A round of applause for her. Let's also welcome the Executive Secretary, Lagos State Blood Transfusion Service, Dr. Bodunri Oshikomaya. You are very much welcome. We also welcome the Senior Special Assistant to Mr. Governor on Health, Dr. Tony Adeyemi. You are very much welcome. In a short while, our special guest of honor, the award-winning governor of Lagos State, Mr. Babajide Olusola Sanwo-Olu, will enter this hall for the formal commencement of this program. Let me refresh our memory that we are gathered here today under the auspices of the Lagos State government in collaboration with the World Bank and key healthcare stakeholders, talking about Impact Project, which stands for Immunization Plus and Malaria Progress by Accelerating Coverage and Transformation Services. One key fact is that our gathering here today is about finding the pathway to malaria pre-elimination and digitization in Lagos State. We're going to take some groundbreaking initiatives which will reduce the malaria burden through digital innovation and strengthened public-private sector collaboration. That is why I said we are here today on the invitation and auspices of Lagos State government, collaborating with the World Bank and key healthcare stakeholders. This project is supported by the World Bank, the World Health Organization, Maisha Meds, the Pharmacy Council of Nigeria, PCN, the National Malaria Elimination Program, MEP, the Society for Family Health, SFH, as well as some other aligned bodies that will seek to move Lagos State towards malaria pre-elimination by enhancing diagnostic accuracy, improving case management, and linking patients to social health insurance schemes. I'm sure our state, the center of excellence, also quickly welcome the representative of the Director General, National Health Insurance Authority, Dr. Kelechi Ohiri. He's being represented here today by the Acting Zonal Director, Ajia Aisha Abubakar Haruna. You are very much welcome, ma'am. I have also seen the Permanent Secretary, Health District 5. Please put your hands together for Dr. Oladipo Ashiyobi. You are very much welcome. Distinguished guests, ladies and gentlemen, let's rise to welcome the Governor of Lagos State, Mr. Babajide Olusola Sanwo-Olu. Let us, with your kind permission, sir, let us rise to sing the national anthem after the count of 3. 1, 2, 3.
Nigeria, we hail thee, our own dear native land. Though tribe and tongue may differ, in brotherhood we stand. Nigerians old and proud to serve our sovereign motherland. Our flag shall be a symbol that truth and justice reign. In peace or battle honored, and this we count as gain. To hang on to our children a banner without stain. O God of all creation, grant this our one request. Help us to build a nation where no man is oppressed. And so with peace and plenty, Nigeria may be blessed.
Thank you very much. We may be seated. Distinguished guests, ladies and gentlemen, let's welcome the Governor of Lagos State, Mr. Babajide Olusola Sanwo-Olu. Let us also welcome the Honourable Minister for Health and Social Welfare, Professor Mohammed Pate, ably represented by the Honourable Minister of State for Health, Dr. Isiaq Adekunle Salako. We also welcome the World Health Organization country representative, Dr. Kasadi Molombo. You are very much welcome. As well as his World Bank counterpart, Dr. Ndiame Drop. You are very much welcome. We welcome the members of the Lagos State Executive Council, especially the Honorable Commissioner for Health, Professor Akin Abayomi, as well as the Special Advisor to Mr. Governor on Health, Dr. Mrs. Kemi Ogunyemi. We welcome the chairmen of statutory commissions and some of their commissioners present, body of permanent secretaries in the Lagos State Public Service. Let me single out the permanent secretary, Ministry of Health, Dr. Olusegun Ogboye, as well as his counterpart in the Lagos State Primary Healthcare Board, Dr. Ibrahim Mustafa, MNI. We also welcome captains of industries as well as stakeholders in the health sector. We welcome top functionaries and heads of ministerial departments and agencies from the federal and Lagos State. We welcome the acting zonal director, National Health Insurance Authority, Hajia Aisha Haruna. We welcome gentlemen of the press, ladies and gentlemen. My name is Kunle Additional. I have the singular honor and privilege to welcome you to this seminar titled Pathway to Malaria Pre-Elimination and Digitization Program in Lagos State. Mr. Governor, sir, I am not alone here. To co-anchor this program with me today is Abiodun Oloyede. Biodun.
Thank you very much, Mr. Kunle Additional. Ladies and gentlemen, please can we put our hands together for the Executive Governor of Lagos State, Mr. Babajide Olusola Sanwo-Olu. Thank you so much, distinguished Governor of Lagos State, for coming. We are very grateful for your presence. Ladies and gentlemen, today we are gathered to advance efforts in malaria control, leveraging technology and data-driven solutions to move closer to malaria pre-elimination. Today's program will feature goodwill messages, which we've had already, technical presentations, and formal launch with the aim of strengthening our collaborative efforts in tackling the scourge of malaria, improving health outcomes, including maternal and under 5 mortality in Lagos State. Ladies and gentlemen, to set the stage for today's discussions, I want to invite the convener of this event, a professor who specializes in internal medicine, hematology, environmental health, biosecurity, and biobanking. Ladies and gentlemen, a man who, in recognition of his hard work and excellence and diligence, particularly in the fight against COVID-19, was conferred with the award of National Productivity Order of Merit by the immediate past president of Nigeria, President Muhammadu Buhari. Ladies and gentlemen, please let's put our hands together as we make welcome the Honourable Commissioner for Health in Lagos State and the convener of this event, Professor Akin Abayomi, to give his welcome remarks. Thank you very much.
Your Excellency, the Executive Governor of Lagos State, Your Excellency, the Honourable Minister of State for Health, Nigeria, ably representing our Coordinating Minister of Health, Professor Mohammed Ali Pate, distinguished members of the Lagos State Executive Council. I know that our Governor is under pressure for time, so I will graciously request that I stand on the established protocol. Mr. Governor, today we're talking about malaria. You're known across Nigeria and Africa, and indeed the world, as the incident commander against COVID. But today we are facing a formidable foe, another pathogen that causes devastation, that causes death, causes poverty, and can shrink economies if not tackled fairly and squarely. So today, Lagos State is trying to demonstrate that over the past 10, 15 years, we've been winning the war against malaria, and we've reached a stage where we can boldly claim that we are on path and on track to achieve what we describe as pre-elimination. So just one slide on what malaria is. I think everybody knows what it is. It is a parasite caused by the Anopheles, the female Anopheles mosquito that bites you and transmits the parasite straight into your blood. It is preventable, curable, and yet remains one of Africa's biggest woes. Just to give you a bit of a demographic profile of the continent, Nigeria has a significant malaria burden at about just over 30%. Other countries around 11%, 5%, Tanzania 4%. But Lagos, right there in the tip of Nigeria, is currently on 2.6%. So Nigeria has this reputation, actually, for the highest malaria burden in the world, accounting for 27% of global cases. 200,000 deaths annually, representing 32% of global deaths as a result of malaria. So it is a problem for us in the country and in the continent, and especially since it is affecting and touching our human capital potential. So WHO have a very easy classification, and if we understand this classification, then it makes a lot of sense. WHO says that when the population, 40% of the population, have the parasite in them at any point in time, either carriers or are acutely unwell with malaria, then you're described as high transmission. If it's between 10 and 39, it's moderate transmission, and if it's between 1 and 9%, it's low transmission, and then less than 1 is pre-elimination. So where is Lagos? Lagos is currently in the low transmission bracket with just under 3%. Now, what is the significance of this graph? It shows that a mosquito, a female mosquito, that is looking to bite 100 people, if 40% of the 100 people have the parasite, then it is able to transmit it to other people easier. So by reducing the prevalence in the community, you're making it harder for the mosquito to find a subject that has the parasite in it that it can consume and pass to another human being. So the malaria burden in Lagos has been dramatically and progressively declining since 2010, 15% to 10% in 2015, and now in 2023 we have 3%. This has been due to the very hard work of the Ministry of Health, our partners, and the private sector to systematically and logically drive down malaria in the state. Despite this, we still see, because of our very large population, we still see about 900,000 cases per annum. And this is the crux of this event. We're trying to get ourselves down to a very low level and classify ourselves as pre-elimination by forcing our cases down to less than 1%. How might we achieve that? Well, I think we have all the ingredients, Your Excellency, to be able to do that. The fact that you are sitting here is a demonstration, and we've been talking about this. You gave us audience last week. You've been talking about it. Health is very much on the front line of all your agendas. With a very strong political will, we are on track. Innovative infrastructural transformation, human resource strategy, digital interventions, health financing through insurance, and our steadfast partners in the donor and the private sector. So Lagos, indeed, is in a unique opportunity to achieve malaria pre-elimination and eventually elimination through these targets. So as you can see there, we've come down a long way in the last 10, 15 years. We're now at 2.6%. The red bar there is 1%. I think we can see that we are on our way. And if we keep up the pressure, we should soon hit that red bar of pre-elimination. So our strategy is no longer treat without a test. We want to drive the use of bed nets, and we want to make sure that we're using our medication judiciously. So Lagos State is very much, in a position where we might be on the verge of pre-elimination. If we just get our ducks in a row, then we might get there sooner than we think. Now, this is a typical waiting room in our primary health care or general hospitals, or even in the private sector, where a majority of people are coming in and describing that they have malaria. And I think this is as a result of institutional memory or community memory. When malaria used to be high, people used to understand that any fever was malaria. So people come in and they tell their doctor that they have malaria. Malaria, they worry me. This one says, I don't know what is worrying me. We know in the medical fraternity that there are myriads of causes of fever that can mimic malaria. So as a good professional environment, we need to be able to distinguish these categories and give the correct amount of treatment. So the first patient consults with the doctor, and the patient usually tells the doctor that I have malaria. It is up to the well-trained doctor to go through a good story with the patient, try and find out exactly what is wrong with the patient. One thing that we don't do much anymore is we don't examine our patients, so we're using this opportunity to advocate that we must do a thorough history and examine the patient. At the end of the day, the doctor says, well, I know you think you have malaria, but we're not doing any guesswork here. We're going to test you. And they do a test, and lo and behold, the test is negative. The patient then asks the doctor, well, so what's next? And says, well, we're going to examine you for other things. And eventually, the patient was found to have, you have a respiratory viral infection. Just go home and rest, avoid contact with other people so that you don't spread the virus. Now, many people would not accept this diagnosis because you've paid money to see the doctor. The doctor has told you, I'm not going to give you any medication other than paracetamol, and I want you to go home and rest. What they might do is go to the doctor next door and say, that doctor I saw there really doesn't know his onions. So the next patient comes in and actually says, I think I have COVID. And the doctor does the same thing, and at the end of the day, we find out that that patient actually does have malaria. But guess what? When he's been told that he has malaria, his response is, doctor, please give me injection. That's the only thing that works for me. And the doctor then smiles and says, well, since you're fit enough, you're not vomiting, you're not dehydrated, your mouth is working, we're going to give you oral medication. All you have to do is make sure you complete your course, and you should be fine, and we'll see you again for a return visit. So I think this battery is dying. Can you change the slide, please? Okay, so let me just go back one. So at the end of the day, everybody that was sitting in this room, all of them expected to be given a diagnosis of malaria. In fact, out of all of 15 of them, they all had different conditions other than malaria. And only one patient indeed had malaria based on our prevailing statistics. So if we didn't take the time to test, take the time to counsel, we would have given almost 14 people the wrong treatment, and that indeed is not a good practice of medicine. So, in essence, our strategy is test, treat, and track. And I've reached the end of my presentation. We plan to strengthen service delivery, integrate digital health solutions, work on our community. Our community are very important. We need to educate them. We need to reduce the release of anti-malarials so we don't develop resistance to the anti-malarials that we have. We need to stop giving arbitrary antibiotics. We need to do proper investigations that make sure we arrive at the diagnosis, or be able to counsel the patient that there's nothing actually wrong with you, that you don't need anything aggressive. So these are our partners that are all present for this event, Your Excellency. And what we plan to do is do a lot of corporate organizational work, citizens, community leaders, policymakers, developmental partners, and at the end of the day, we're grateful to you for your commitment and your solidarity. I thank you for your attention.
Can we please once again appreciate the Honourable Commissioner for Health, Professor Akin Abayomi. Let me also welcome the Honourable Commissioner for Health from Ogun State, Dr. Tomilola Koka. Thanks for joining us. Thank you, Madam. Next on the program lineup, we'll go on to take
Okay, ladies and gentlemen, on the program lineup, we have Impact Project presentation, and to lead the team of medical doctors for a brief presentation on the Impact Project, he's a senior health specialist at World Bank Group. Ladies and gentlemen, Your Excellencies, he brings experience from previous roles at Palladium, Make It Possible, Marie Stops, international organization in Nigeria. Ladies and gentlemen, Your Excellency, I want to specially request that we put our hands together for Dr. Honourable Ezire, accompanied by Dr. Bimbo Oshinowo, Dr. Veronica Iwayemi, and Dr. Abiola Idowu.
Who is the Executive Secretary, a farmer, one of our own in Lagos State.
Your Excellency, sir, the Executive Governor of Lagos State, the Honourable Minister of Health, Dr. Razik, my Country Director, Dr. Diop Diame, WHO Country Rep, Dr. Water, other dignitaries seated. Your Excellency, sir, when the project was introduced, I keep telling others that unless Lagos implements Impact Project, I'm not sure we're going to have the level of impact we should. And I'm excited to say that under the leadership of Professor Abayomi, Lagos State is really doing well and we are set to go. I really especially want to thank Prof. Prof, sir. It's not good in Africa setting asking somebody older to stand up. It's not very good, but I'm going to ask you to stand up because I really want everybody to recognize the good work that you have done. Thank you very much, Prof. Impact Project would have been dead if not for Prof. So, Prof, thank you very much. You make it happen in Lagos State. The Impact Project is the federal government of Nigeria initiative to address two key issues. The first is we understand that it's everywhere that a lot of children are dying of things that are preventable. Two things. Malaria is a major cause, and of course immunization and other RMSE services. Your Excellency, sir, if you deal with the problem of malaria, 3 out of every under 5 deaths can be prevented just by dealing with the issue of malaria. And if you deal with the issue of immunization and that of other things related to child health, you can again reduce the number of deaths very significantly. But the question is, as simple as these solutions, why are they not being implemented? So we're here to work with you to achieve that. The project was approved in 2020. It became effective 2021. And I'm sad to say that by December this year, the project is ending. I always tell my friends and my colleagues that this is a project that we are implementing in 28 states. And I wake up every morning, before 6 o'clock, I have over 30 issues to address. Complaining this state, challenging this there. And I ask myself that what will life be for me by December 30 when this project ends? And I don't wake up to have those marriage of issues I need to address early in the morning and before I go to bed. But that is just a story that we're ending in 2025. But I'm saying this just to draw me the need for urgency. That this pre-elimination activity we have in Lagos, that the WHO management are implementing, we must start as of yesterday. No room for delays. The project overall envelope is $650 million, and at the national level is led by NMEP and MPHCDA. Then at the state level, we have the State Primary Healthcare Board and the State Malaria Elimination Program. Your Excellency, sir, when we started, we were just in 18 states, and Lagos State was admitted to implement just the malaria component. But today, the Impact Project is in 28 states, and Lagos is implementing both components, the malaria components and the immunization components. And just to note that these are the amounts available, but for this year alone, for Lagos State, There's a $20 million earmark for these two components in Lagos State just for 2025. Earmark, I use the word earmark because you can only get it if you implement the activities. If activities are not implemented, that fund may not be available. So it needs to be implemented. Second slide. In 2025, in Lagos State and in Nigeria, these are the things we are committed to. We promised the Honourable Minister that through this project, we are going to double figures that were observed in 2024. The number of malaria testing last year, we want to double it, especially among children under 5. We want to promote the use of ACT. Now, there is a section here that our contractor will do. We don't want to give ACTs without testing. And the message from the Commissioner was very clear. Test, treat. So we're going to provide ACTs for children under 5. We're also going to make available long-lasting insecticide nets for children under 5 and pregnant women. And most importantly, to prevent maternal mortality, we want to make IPT3 available. Now, what IP3 does is to prevent anemia in pregnancy, which is a leading cause of death among women who are pregnant. It's a message we preach that we don't want any woman to die because she is pregnant. And malaria is one of the leading causes of our women dying because they are pregnant. We can avoid that. Your Excellency and the Honourable Minister, the project is also committed to increasing the number of women that deliver assisted by a skilled birth professional, either a doctor, a nurse, or whatever. Lastly, we want to promote postnatal care on the fully immunized and IP3. Beyond service delivery, one thing is to make service available, the other is to ensure the services are of good quality. If they are not of good quality, they will not come back again. And so the second objective we want to achieve nationwide is to improve the quality of our healthcare services. And those are indicators we are looking at. If you intend to increase the number of service delivery, you increase quality of care, you need to have strong institutions to ensure that those things are delivered and they are sustained. And so the projects nationwide, and especially in Lagos State, we are committed to strengthening institutions in Lagos State so that when the project ends, they can continue with the intervention. And in the spirit of strengthening institutions, we are working with the State Malaria Elimination Program, leading component 1. We are working with the State Primary Healthcare Board, leading component 2. And we are working with a farmer who is promoting issues of quality. So I'm going to invite them, Your Excellency, for each of them to say brief in terms of what they plan to do under each of these components and the result we want to see in 2025. Dr. Bimbo.
Good afternoon, Your Excellency, the Executive Governor of Lagos State, Mr. Babajide Sanwo-Olu, the Honourable Minister for Health and Social Welfare. So I'll talk briefly about malaria, the component 1, that is the malaria control. And this component is responsible for providing malaria services to Lagosians, targeting the vulnerable group. We're looking at our pregnant women and children under 5 to reduce morbidity and mortality from the disease. The component uses performance-based contracts to deliver malaria services, malaria interventions, including providing anti-malarial medicines and commodities. We're looking at our insecticide-treated nets, malaria test kits, our artemisinin-based combination therapies, otherwise known as the ACTs. We equally want to conduct social and behavioral change communication on malaria and improving diagnostic accuracy, among others. So the service delivery target for 2025, we're going to provide over 2,000 ACTs. As at the moment, February 2025, we've done 144,000. 2 million, sorry. We've done 144,000. For malaria tests, we want to conduct about 2.1 million tests, and so far we've done 110,000. For sulfadoxine pyrimethamine, which is to prevent our malaria in pregnancy, we intend to provide over 720,000 SPs for our pregnant women, and so far we've done 32,700. A tetanus injection to prevent severe malaria, we want to make available 130 over 130,000 vials, and so far we've provided 14,390. And insecticides treated nets 273,411 is what we're looking at to provide. Thank you.
Good afternoon, Your Excellency, the Executive Governor of Lagos State, Mr. Babajide Sanwo-Olu, the Honourable Minister for Health and Social Welfare. It's a pleasure. Please permit me to observe all of the protocols as established. So I will be speaking to the immunization component of the IMPACT project. The IMPACT project, as we know, fits into the Teams Plus agenda of the Lagos State government and also into the health sector strategic blueprint. The major aim here is to scale up services towards immunization, reproductive, maternal, newborn, and child health, with particular focus on children under 5. Now, in order to achieve this, we had to look at our bottlenecks. Which bottlenecks do we have that exist? And so we found 3 major bottlenecks in infrastructure with regards to healthcare workers' competency and also community engagement. Our major focuses were that we found that we had inconsistency in power supply. We had to address that because it would affect our vaccine storage and, of course, service delivery. We also had to look into water supply, ensuring that we had clean, functional water at our PHCs. And then accommodation for our staff. And of course, because our PHCs have been in existence for quite a while, there are aging building structures. We also looked at the healthcare workers' competency. As you know, with Lagos being the center of excellence, as we're having on a daily basis migration of citizens into Lagos, we're also having migration of healthcare workers out of the country. And that was also particularly skilled healthcare workers. And then, of course, fragmentation of our healthcare services and limited opportunities for continuous medical education for our healthcare staff. Because of the cost, most of them would have to pay out of pocket in order to get to improve on their competency. And so, finally, with community engagement, we understand in providing primary healthcare services, we need community ownership. And there were challenges, bottlenecks identified. One, there's limited access to reliable health information, and we needed to address that. And then, of course, there's the trust and perception of what PHC is in terms of awareness and understanding of available PHC services. And, of course, the lack of adequate community involvement in primary healthcare services. So, having identified the bottlenecks, we looked into opportunities for us to be able to improve on this. And that's where we came up with the upgrading of primary healthcare facilities, upgrading to meet modern standards. So we were looking at, with respect to power supply, ensuring sustainable energy in terms of installing solar powers, and then, of course, in terms of our water infrastructure, ensuring there are boreholes, functional water, treated water, and then, of course, in terms of provision of accommodation. And then we went further. We are instituting what we call biodegradable sewage system, sewage management system, where we're able to turn waste into wealth. So those were the innovations we're looking into. And then for enhancing our healthcare workers' competency, we understand we're trying to enhance in-service training, making it cost-effective, because then the government takes on the cost of building the capacity of our healthcare workers. And then, of course, collaborating with knowledge sharing at the PHC levels and also between the primary and the secondary healthcare. We're also looking to clinical mentorship and training. And, of course, incentivizing. Incentivizing at the local government health authority level, incentivizing for healthcare workers that actually are able to put in more than 100% who are responding, and, of course, course, providing excellent services. And finally, community engagement. We wanted to enhance community engagement so that the community leaders, the religious leaders, those who matter, are factored into the planning and also decision-making with regards to community healthcare services. And of course, thereby building trust through partnership and ensuring that we're able to reach to rural, hard-to-reach areas by intensifying our programs. Now, having said that, this is our commitment and performance scheme. We're looking, just like Dr. Honourable said, we will be looking at persons presenting with fever and being tested. Now, what you see is our target for 2025. And next to it, you see what we have so far in January 2025. Please permit me to note that we've only just started with this, and so therefore our indices will gradually start reflecting the commitment that has been put into this. And so we will be looking at skilled birth deliveries, ensuring that women have access to skilled birth delivery and take advantage of the opportunity, ensuring that pregnant women are provided with LLINs, ensuring that postnatal care for newborn and mothers are within 7 days of delivery so we can eliminate any complications. And then, of course, for children under 5, making sure they're fully immunized. At this point, the project interventions are there, but I will hand over at this point to the Executive Secretary of EFAMA to please continue. Thank you.
The Executive Governor of Lagos State, Mr. Babajide Sanwo-Olu, the Honourable Minister for Health and Social Welfare, kindly permit me to stand on existing protocols. The Health Facilities Monitoring and Accreditation Agency was set up by the Health Sector Reform Law of 2006 to improve the quality of care in both public and private health facilities by setting minimum standards and by ensuring that these standards are complied with through adequate monitoring and inspection of health facilities. The functions of the agency is broadly divided into 4 thematic areas: setting standards, ensuring that facilities are inspected, registered and licensed, carrying out researches to inform the quality of care in the state, and of course, compliance and enforcement. Oops. So just in a nutshell, this is our data for 2024, and it is going to act as a baseline for the expected outcomes when we are going to measure the impact of the project or for a farmer. Mr. Governor has graciously transformed a farmer. EFAMA is the foremost health care regulatory agency in Nigeria. And for last year, we were able to visit 1,716 facilities at least once for quality assurance. We shut down 65 healthcare facilities for non-compliance. And despite the huge investments and the transformation of Mr. Governor by approving public-private partnership model for monitoring, approving the accreditation of the agency we're going to complete, we're at the final process this year, and of course, approving a digital platform for EFAMA. We still have some issues that are causing operational inefficiencies in the agency. For example, limited monitoring coverage. There are various health facilities that are spread all over Lagos. We have over thousands of health facilities in all the nook and crannies, in remote areas, and including hard-to-reach areas. We have different categories: clinics, maternity homes, artificial reproductive technique facilities. We also have in recent times, cosmetic clinics. So we're finding it difficult. We have limited capacity to ensure monitoring of these facilities. We also have inefficient manual processes because our digital platform is unable to carry out some of the processes in the agency. We're sitting on a lot of data in the agency, the data that we gather from monitoring and inspections, but we're unable to carry out analytics on this. Then we need to engage with the general public to ensure that they patronize only facilities that are recognized by a farmer. We need to say it loud and clear to the general public. Despite all the investments, we, like Oliver Twist say, we need more. And we are hoping that the impact project, the funding from the impact project is going to give us these expected results, that we're going to have increase in the number of facilities that we would visit in year 2025 by 30%, that would have improved compliance and enhancement of data-driven decision-making using data analytics, that we're going to strengthen collaboration between our partners, and we're going to have 25% increase in our compliance rates by carrying out the key strategies. We want to expand our monitoring coverage. We want to enhance our digital infrastructure by integrating a secure online pathway. We also want to include the e-learning platform and our mobile platforms on the digital infrastructure. We want to strengthen our community engagement and build capacity of both the farmer staff and our partners. We want to drive innovation and research. This year, we want to carry out research on the quality of care. In doing all of this, we want to make the health facilities in Lagos safer by, leveraging on technology and ensuring that all our processes are data-driven. Thank you very much.
Thank you very much, Dr. Honourable, Dr. Bimbo Shinowo, Dr. Veronica Iwayemi, and Dr. Abiola Idowu. Your Excellency, the Governor of Lagos State, Mr. Babajide Olusola Sanwo-Olu, the Honourable Minister of State for Health, Dr. Isiaq Salako. Taking us further in the comparative study, I want to especially welcome a professor and consultant medical parasitologist at the College of Medicine, University of Lagos. He coordinates the International Malaria Microscopy RDT Quality Assurance Center, as well as the country's World Health Organization malaria specimen collection sites in the College of Medicine, University of Lagos. Ladies and gentlemen, please let's put our hands together for Professor Wellington Oyibo for the very short comparative study. Thank you very much.
Thank you very much, His Excellency, Executive Governor of Lagos State, the Honourable Minister of Health, here represented here by the Minister of State for Health. Ladies and gentlemen, first of all, this is historic for us. This is a path we have planned, prayed for, and we are happy that it is happening here. Mr. Governor, thank you for all that you do and for making this happen. My slides. I'm so happy and grateful to the Honourable Commissioner of Health. He has told the story. So I'm going to build on those stories as I make this presentation. Can we have my slide? And part of the whole thing is the advances that Lagos State has made for over 2 decades. The world is hearing it, and then the signature of this project through the impact project itself, which is calibrated around the impacts that this project will make, again, for Lagos State. My slide, please. So what we know about malaria, in the 15th century, why was it called malaria? It was called malaria because the cause of that febrile illness was not known. And it was connected to marshy waters. So malaria in Greek is foul air. And that was all they could do. And it took another 100 years before it was connected to mosquito bites. And today we are talking about fever and say all fevers are malaria. So are we going to the 15th century? And this is what we're trying to really unbundle in Lagos State, a state with over 30 million people. My slides? Okay, let's pull it up from here. So if fever is still malaria, we go back to the 15th century. And then, of course, for evidence base, it meant that we will have to quickly provide the evidence. Can I have the slide up, please? Yes, it's important. So the Honourable, let me just pull it out from here. I have it here. Just a second. Okay, great. So I've given this background. Most health workers will not accept the test results when it's negative. And that's the challenge. Next slide, please. Okay, and if you don't have data, which we are talking about digitization, you cannot calibrate where you are. And so if we look at the entire program and the plan of the impact projects, is to see that real-time data is available and that tests are done. And when the test is done, we can say quickly, cost-effectively, this is where we are. Cost, because you can rely on routine data. The country do not have quality data, and that's the challenge. Next slide. So no confidence in the tests. ACTs are being used. Lagos is making progress. How do we handle this? 94 to 96% of the reporting for malaria in the DHIS2 that categorizes states and Nigeria comes from the primary healthcare center, at least from the public sector. It's important to recognize this. Next slide. And we're bringing this on board because we provide the platform for quality diagnosis at the College of Medicine. Next slide. And we do all of this carefully to ensure that these tests are good to be used for humans. Next slide. And what is known? Please just keep on going on the slides, because I'll just speak through them. There are changes in Nigeria in terms of malaria epidemiology. Next slide. And then we see from the 2021 malaria indicator survey where Lagos is. Next slide. And you can see where we are here at 2.6%. Hopeful. And next slide. Good progress. And we're talking about the path for pre-elimination. We are on that path. And we are happy that this is being mentioned here today, and like I said, it is signature. And in line with the stratification strategy and subnational tailoring by WHO. So we are quite on course on this. Next slide. And then you can see the different tests available. You can keep on hitting enter. You have microscopy that is powered by a human being. And then you have this rapid diagnostic test that is technology. But somehow, we refuse to accept technology, and we stay with humans, with all the challenges. So that's what you see with microscopy. Just keep on pressing enter, and all of this. And this is the test, 15 minutes, your result is out. The other one could take any time, and it could be one day. And then based on that, we had done a scoping assessment of facility in Lagos. With this fantastic 2.6, what is expected? That malaria should not be contributing so much to fevers in the states. And we've seen this here in the national reporting. This is what you see for Lagos in between 2015 and the mid part of 2024. You see test positivity rates, 74, 75%. Yeah, so a couple of things to do here. And within the local governments, you can see here, and that is the true figure will be seen, but it could be less. And we have the evidence around what malaria diagnosis is in the country. Next slide. Just keep on hitting next slide. Those evidences are there. But where the Honourable Commissioner was talking about is this place. And that's the area we are calibrating around, because it's already known that these tests work. Why would you want to compare microscopy and malaria? You will see a lot of fever cases, far more non-malaria fever cases overshadowing malaria. And the state doesn't want to go into a program where you cause a problem for another. So next slide. So we have evidences around beyond malaria. What next? So next slide. Next slide. Next slide. These are evidences. They are known. But what is planned in the impact study? Next slide. So what we want to do, we will assess the microscopy, assess the rapid diagnostic test, and still be able to have that evidence moved into how we can address the larger fever cases. And these are the objectives, very clearly stated and fitting the situation. Next slide. In this algorithm, you see what we want to really do. This question here, if not malaria, what else? It's a big challenge. But Lagos State is taking this up in this comparative study, knowing that you cannot be clear-footed on malaria, but be able to look at other causes of disease. These are the measurements, and we are bringing the very best of quality into it. Next slide. And the benefits are very clear. And in this strategy, we have a multi-stakeholder engagement. I'm so happy the president of the Pharmaceutical Council is here, because there are great benefits. Next slide. This is what you see in a typical setting. When you implement this is December in one of the facilities in Ogun State. You can see here, these are negative tests. You only have few malaria cases to treat. And then we'll be achieving this goal and targets for malaria if we follow the due testing and treatments. And then the benefits, health benefits. Out of pocket spending for what you don't know that you take medicines for. You're talking about even economic benefits. Here, in 2005, when RDT was introduced, this country, Zimbabwe, saved $1 million. We will save money. That's the economic cost. In Senegal, they were able to push this scale up, and they got ACTs. The money you spend for the medicines, you pull it to other use. And this is what we intend to see, Mr. Governor, that the states of excellence, Lagos State, will promote best practices, will attend to the health of the people, will save money, and then be able to put her signature in the Committee of Nations. I want to congratulate again Mr. Governor for all that you do. Thank you so very much. Thank you.
Thank you very much, Professor Wellington Oyibo. Your Excellency, distinguished ladies and gentlemen, to share insights on the pathway to malaria pre-elimination and digitization initiative, I want to specially welcome the CEO of MyShemeds, a company that has created one of the largest digital networks of private pharmacies and clinics in Africa, and their programs have helped over 1 million people across Africa to access care for malaria, family planning, and HIV prevention. Ladies and gentlemen, please put your hands together for Dr. Jessica Vernon, the CEO, MyShemeds. For the next 3 minutes, she'll be giving us insights into the pathway to malaria pre-elimination. Thank you very much.
Your Excellencies, thank you so much for having me, and Honourable Commissioner and distinguished guests. I'm moving quite quickly through slides for time, so there are additional ones that we can potentially talk through later, but to go through specifics on pre-elimination and how MyShemeds and all of our partners are supporting on this important work, I wanted to first give an introduction to the work that we're doing in our software. So we first started working in Lagos State several years ago. We had been told that there was that the burden of malaria in Lagos State was quite low, but when we spoke with our pharmacy and PPMV partners, they said that malaria was quite high in Lagos. So we supported with a digital intervention with AI to validate the malaria rapid test result. And we found that the malaria test positivity rate for patients who thought they had malaria that were febrile was actually 5 to 7% versus 50% in northern Nigeria. So this was quite low. But when we talked to the PPMVs, they actually weren't aware that malaria rates were so low in Lagos State. So we have been speaking with NMEP, with Lagos State and with others about how we can support on getting the word out and ensuring that there is appropriate diagnosis and then treatment for malaria. So a bit more about us. So we have developed technology for pharmacies and PPMVs. We're currently supporting about 4,500 pharmacies and clinics and PPMVs across the continent. We're supporting about 25 million patient encounters annually, and so have great data on exactly what's being sold in a private sector setting. As I'm sure you all are very aware, 50% of patients are going to the private sector to access care, so it's very important to ensure that there's quality care there. And then we've built a digital reimbursement system to enable patients who have malaria testing to get reimbursed to ensure that they're getting quality care. And we've supported this for over 1 million patients to date. Next slide, please. And so I wanted to talk a bit more about the specific work that's being done in the impact study, or the impact program. So normally a patient will go to a pharmacy and they'll say, I have malaria, I'd like to get treatment. In those cases, especially in Lagos State, there's very low malaria, and so they're often getting treatment that they don't need. Thank you. Treatment that they don't need. They're spending extra money on this, and sometimes it's often not quality assured as well. In our program, we incentivize testing before treatment. We validate the test results with AI to make sure that the test is actually having the results that the pharmacy or PPMV says it does. We then verify that the appropriate treatment is given. And then in the impact program, we are supporting referrals to the public health system for malaria-negative patients to ensure that they're getting the proper diagnosis that they need and have a better understanding of what other febrile illnesses patient might have. Next slide, please. Next slide, please. Okay, so I'll just talk briefly about all of the other partners that are working on this as well. So we are working closely, of course, with the Lagos State Ministry of Health, which envisioned this work and brought us in to support on this, with NMEP, which is overseeing the work and providing technical oversight, with WHO, which is providing, again, technical support and facilitation, and then importantly with our private sector partners as well. So PCN, which is doing quite a bit of the regulatory oversight and ensuring the quality of care in a pharmacy setting, with SFH, which is enabling the supply chain, and then of course with LASHMA, which is supporting with reimbursement here. To go quickly into final results on why this is kind of improved quality of care. Oh, okay. Sorry about that. So the work is providing network expansion, innovative financing, integrated health systems, supply chain resilience, comparative research, and regulatory reform, leveraging all of these different partners that we've mentioned to ensure that patients are able to access quality care and that the data is being provided back to Lagos State to help improve regulatory support, policy, and other things. I've mentioned the partners that we have here already. But we're very grateful for all of the work that they are providing to ensure that there's quality of care in private sector. And then finally, one final slide. To reinforce what Dr. Wellington said earlier, the work that is being done is also to be supporting with testing, understanding the difference between rapid tests and microscopy to support on policy reform to ensure that rapid tests are always done before treatment for malaria in Lagos State. Thank you all so much, and we're very excited to be a part of this.
Thank you very much, Dr. Jessica Vernon, the CEO, Maisha Meds. Ladies and gentlemen, taking us further on Nigerian strategy for tackling malaria, the need for test and treat, is the National Coordinator of Nigeria's National Malaria Elimination Program, NMEP. Ladies and gentlemen, please let's put our hands together for Dr. Nnenna Ogbulafo. Thank you very much.
Thank you very much, sir. Thank you very much, sir. Your Excellency, sir, we're very happy that this is happening today, so just permit me to do something unique in terms of our focus for malaria control in Nigeria. To do this, I will call on Dr. Daop, the country director for World Bank. Please, can you join me on stage, sir? Thank you very much. And quickly, we're going to have the Honourable Minister being tested for malaria today. Honourable Minister, please, sir. Thank you very much, sir. This is showcasing the main focus for malaria control in Nigeria, which we refer to as the 3 T's. Your Excellency, the first T stands for tests. We cannot overemphasize or we cannot underscore the importance of that. The second T, sir, is for treatment. Okay. The second T is the treat, and that is if the test is positive for malaria. And the last T is for track. You need to track it. Surveillance is important because that's what is telling us if we're going to pre-elimination in Lagos or not. And when we say surveillance, we mean appropriate surveillance. How are we doing over there? Okay, great. While we're doing that, so I've just been told that I should also humbly call His Excellency, the Governor of Lagos, to the table.
Yes, Mr. Babajide.
Your Excellency, sir. Thank you very much, sir. Thank you very much, sir. So while this is going on, we don't have the time again for me to take my presentation, but it's just to say that our dear Honourable Commissioner of Health, Lagos, call him the Professor of Health, had done justice to some of my slides. So I'm kind of showcasing this slide for emphasis sake. So it's important to note that the kits. Your Excellency, sir. Fifteen. But we can be doing other things. We will not have the Honourable. We cannot have His Excellency and the Minister of Health standing for long. So once we take their samples, we're going to have them seated again. So can I have Dr. Walter on stage to come and quality check what is happening, sir, please? Thank you very much.
Excellencies, thank you very much.
We are witnessing leadership by example.
Exactly.
Leadership by example by Mr. Governor, Mr. Babajide Olusola Sanwo-Olu, as well as the Honourable Minister of State for Health, Dr. Salako. Please, let's appreciate them.
Thank you very much.
That is the way to go for every one of us all.
Thank you very much, Your Excellencies. So again, this is the way to go for malaria control program in Nigeria and globally. Because I don't have time, I'm not going to do my slides, but I just want everybody to look at the third bullet on that in my reflections. So it says that pre-elimination in Nigeria could commence in phases. We could commence pre-elimination in Nigeria in phases. Thank you, Your Excellencies. Thank you. So back to the fourth bullet on my slide. Your Excellencies, pre-elimination in Nigeria could be commenced in phases. It could start with the states, Lagos State, for example, and we could go geopolitical zones. So I was sitting with my sister, the Commissioner of Health from Ogun State. So the fever for pre-elimination have started. So I also want to say that it stands on Lagos State to make sure that this pathway for pre-elimination is properly done. The National Malaria Elimination Program is waiting to take the experiences and the processes that Lagos will use to achieve elimination to be replicated in other states. Your Excellencies, it's important to note that right now we have a couple of states under 10% prevalence in the country, and those states are Anambra, Kwara, and Rivers State. So what is happening in Lagos that has been flagged off today, it's NMEP, it's poised to take what these processes and experiences are to states like that. Thank you very much.
Thank you very much, Ma. Let's appreciate her. Thank you very much. Thank you very much. Mr. Governor, sir, distinguished guests, ladies and gentlemen, next, with your kind permission, I will now invite for his address the Honourable Minister of Health and Social Welfare, Professor Mohammed Ali Pate, who has been ably represented here today by the Honourable Minister of State for Health, Dr. Isiaq Adekunle Salako. A round of applause for him, please.
Your Excellency, the excellent Governor of the Center of Excellence, Mr. Babajide Olusola Sanwo-Olu, I must recognize my brother, who is the one who has summoned all of us here today, the Honourable Commissioner for Health for Lagos State, and all members of the Lagos State Cabinet here present, our partners, WHO, World Bank, distinguished stakeholders in the health sector, gentlemen of the press. Because of time, let me say all protocols duly extended. We cannot keep the governor for malaria alone. He has to attend to water, to road, to several other things. So I will shorten my speech, but I must say that today I'm wearing two caps. You may not see it physically. I'm standing in for myself and also standing in for my brother, the Coordinating Minister for Health and Social Welfare, Professor Pate, who is unable to attend because of other assignments. I am most delighted to be at this auspicious occasion of the launch of the Pathway to Malaria Pre-Elimination and Digitization program in the Center of Excellence, Lagos State, led by His Excellency, the Governor, Mr. Babajide Sanwo-Olu. I recall that Lagos State pioneered intensive malaria case management in the early 2000s through the Eco-Free Malaria Initiative under the leadership of now our President, President Bola Ahmed Tinubu, who was then governor. I am most delighted to be here today to be part of another pioneering initiative now under Governor Babatunde Sanwo-Olu as Lagos State takes the lead in the agenda to end malaria by 2030. Your Excellency, the Federal Ministry of Health and Social Welfare is elated with this giant stride, which aims to improve malaria diagnosis, case management, and accurate tracking of cases through the integration of digital health solutions in the form of real-time electronic reporting systems, all targeted at further reduction in the burden of malaria and its eventual elimination from our land. This momentous project will not only set the track for malaria pre-elimination in Lagos State, but in Nigeria at large, thereby once again making Lagos State a trailblazer. I want to emphasize that this project is in line with the renewed hope agenda of President Bola Ahmed Tinubu and the renewed vigor of the Federal Ministry of Health and Social Welfare on the Rethinking Malaria concept that was launched in April 2024 and is aimed at fast-tracking the malaria elimination goal through strategic shifts. We have continued to make progress in this regard, and the inauguration of the Advisory on Malaria Elimination in Nigeria, AMEN, the development of pragmatic costed plan of action, the expansion of primary healthcare facilities, training of frontline health workers, and the initiation of domestication of affordable medicine facility for malaria to make malaria treatment more affordable are all testament to the progress we are making. Your Excellency, distinguished ladies and gentlemen, the Ministry is taking these steps in order to reverse the undesirable trend of being the highest burden malaria endemic country globally, accounting for 27% and 31% of cases and deaths, respectively. I am confident that the Lagos State possesses the needed attributes that can help drive Nigeria to malaria elimination through such pace-setting initiatives like this program. Furthermore, Lagos has been consistently the lowest malaria prevalence state in Nigeria, as evidenced from all the malaria indicator survey conducted in the country, with the most recent result in 2021 showing 2% prevalence, hence indicating a tendency of attaining pre-elimination when concerted and consolidated efforts are put in place. I wish to report that the challenge of, let me use this opportunity to call on all stakeholders not to relent on their support towards this impactful intervention, which will contribute significantly to the drive at eliminating malaria from the world. Nigeria is ever committed to this drive, and we will continue to toe the path of global best practices. I wish to assure all Nigerians and our partners that the change in the policy of the United States government with respect to global health funding will not adversely affect our malaria elimination programs and other public health initiatives, as President Bola Ahmed Tinubu, GCFR, has approved a robust mechanism to ensure adequate and cost-effective funding for our public health programs. I call on all state governments to join hands with the federal government to ensure that our country becomes self-sustaining in the funding of our public health programs. Before I end this address, let me commend once again and appreciate His Excellency, the Governor of Lagos State, Mr. Babajide Sanwo-Olu, and his health team, led by Professor Akin Abayomi, for initiating and executing this laudable, innovative project. I wish to also sincerely appreciate all the partners, World Bank, WHO, all the implementers, especially for providing the needed human resources, technical support, and the funding for the implementation of this initiative. I wish all of us a successful launch of this impactful project as a springboard for the elimination of malaria from our country. Thank you, and God bless the Federal Republic of Nigeria.
Can we please make the applause more resounding for the Honourable Minister of State for Health? Thank you very much, sir. Mr. Governor, sir, with your kind permission, I would like to invite the Honourable Commissioner for Health once again to please come and announce the results of the tests, after which he will invite Mr. Governor to address this gathering.
Distinguished invited guests, Your Excellencies, the Honourable Minister of State, and our excellent Governor, I have your results. I'm pleased to say that the Honourable Minister of State may return to Abuja this evening. We will not be confining you in a bed in Lagos. Your result is negative. Congratulations. Indeed, when patients go to clinics and the doctors tell you that they've performed a test, it is your responsibility as a patient to see the test. Please ask for the test and take a picture of it and have a record on your phone. My governor, the Excellency of Lagos State, I'm pleased to tell you that you may continue with your duties for the rest of the day.
Congratulations, sir.
Your test is negative, in line with the low prevalence of malaria in Lagos as we chart a course to pre-elimination. Thank you very much for your support, both the Honourable Minister and our Governor and members of the Lagos State Executive Council. Mr. Governor, if you would like to approach the podium to give your keynote and to launch the pathway to malaria elimination in Lagos.
Thank you very much. Please be seated. Thank you. Thank you very much. The Honourable Minister of Health and Social Welfare, Professor Muhammad Ali Pate, here ably represented by one of us, our own Honourable Minister of State for Health, a practitioner himself, and a strong politician, Dr. Isiaq Adekunle Salako. Thank you very much for finding out time to be here. Members of the State Executive Council, especially Professor Akin Abayomi, and Special Advisor on Health, thank you very much. Other cabinet members, all the permanent secretaries in the Health Ministry, there are several of you that are here. Thank you very much for taking out time. The country director for the World Bank, Dr. Diop, the country representative for the WHO, Dr. Walter, all of our partners that are here, MyShamed, Impact, SFH, the National Malaria Organization, our friends from our neighboring state, the Honourable Commissioner for Health in Ogun State, thank you. All of our health practitioners and stakeholders that are here, gentlemen of the press, ladies and gentlemen. When you are asked to come forward and conduct a test, that you did not prior psych yourself for, what will happen is you quickly raise, your brain will raise back and say, have I been feeling unwell? What is going to happen? It just brought us back 5 years during COVID, and they said that you're going to do a COVID test. It was like, the heart was going to open and you don't know what will be the outcome. But you see, it's an important activity that we need to continue to subject ourselves to. We might think it's a simple thing, but it's so important. And that ability for you to come forward, if it has turned positive, what it will have just meant is that we need to make a treatment. It's not a death penalty, but it's really just for all of us to know that we need to do this thing, and we need to be able to come forward transparently at all times and let us end all of these things that we don't want again in our society. Thank you very much. And so it's an honor that I stand before all of you in this room are very strategic to launch the first in the country, another Lagos first, the pathway to malaria pre-elimination and digitalization program. We're here to affirm our commitment to safeguarding lives and the livelihood of every Lagosian. Malaria is more than a disease. It's a social economic burden that has held back individuals. It has held back families and communities for such a long time. It robs us of our productivity. It drains us of our household incomes. And for many households in Lagos, especially those modest earners, malaria, the name alone, brings shivers. It reduces their earning and reduces their ability to continue to earn more for their family. And so this financial strain often affects families, and a lot of times causes heartbreaks and the rest of it. But we're here to put a stop, or to even lend a voice to the step at which we want to eliminate that completely. It has affected school children from going to school. It has affected businesses. It has seen a whole lot of absenteeism and a lot of challenges in our society for several decades. But today, we are here to change all of that narrative. The eradication of malaria is not just a good health news. It is indeed an economic imperative. It's a good news that all of us must beat our chest and be able to carry, if there's a pin, that we need to have, a pre-elimination, the campaign for it. We need to have it, and we need to be able to dot it everywhere proudly. We know from statistics how much malaria has cost our GDP, billions and billions of dollars. Imagine what Lagos could achieve with a lot of resources if we're able to eliminate all of this. We no longer have to choose between survival and opportunity. Imagine a Lagos where every child can attend school uninterrupted because of ill health, or an adult can contribute fully to the economy. And one thing that is instructive was the demonstration of the slides by Professor Akiambel, and I saw others as well. I can see that Prof already has a side job. Animation and cartoonist in all of it is a job that he can conveniently retire into. And the narratives were very clear. But the message was very, very transparently done. And all of us, in one form or the other, are guilty of this. You feel unwell, you think you have a fever, the next thing is you are diagnosing yourself with malaria. Very easy. Just give me injection. Just give me this tablet. I know what it is. We are all, self-diagnosing ourselves and self-telling ourselves that that is what it can only be, and that is what it is. So just give us. But we can see that with knowledge and with communication, a lot of all of those negative things, we can rewrite them. And so this program represents a hope rooted on innovation, collaboration, and determination by leveraging digital tools that will ensure that every malaria case is tracked in real time. This is digital. Long in those days when you need to take a whole full blood from your body to just do a simple malaria test. I was asking for my bottle of Maltina, because those days when they take your blood test, they must replenish it with a bottle of Maltina. But you can see that with just a small prick, and in no time, you can actually, that's what digital life, has done. And so it has helped us by strengthening partnership with the private sector. We'll expand access for quality care. It will help communities to have the knowledge and resource. It will build a culture of preventing that leaves no one behind. And that's the message we need to come out of from here. All of us sitting in this room must immediately turn ourselves into an advocate, into a cheerleader, to be able to carry this message forward, to be able to tell everybody that needs to know. Go into our communities, pass on this message that this pre-elimination launch program had started, and it's for all of us to see it, to buy into it, and to work with it. The benefit of eradicating malaria goes beyond just health. A malaria-free Lagos, and indeed in future, a malaria-free Nigeria, it's achievable in our time. And we've all put our minds to it, it's something that could be done. We believe that if we can eliminate it, it will increase productivity, it will improve educational outcomes from our children, it will reduce considerably our health costs. It will also enhance quality of life. I mean, all of these points speaks to a better livability standards, in all indices. And so this vision, though ambitious, I believe is achievable. It requires, therefore, all of us, government agencies, healthcare practitioners, healthcare providers, community leaders, development partners, and indeed all citizens to work together with an unwavering resolve. Success will not come overnight, but will be sustained effort and collaborative action. We will prevail. You saw the slides that a farmer and the lady on malaria and the lady on immunization. You saw the statistics between January and February, what the run rate should be. Yes, we could say that, this is just March, but we need to be able to double those numbers. We need to push those numbers to be able to achieve the 2025 targets. We need to be able to push and achieve, because there's no magic to it. If your target is 2 million, and at the end of February, we are still doing less than 200,000. You are doing far, far less. So you need to double, your spike shoes. You need to work harder, twice as as much for you to achieve the 2025 record. And Doctor told us, Prof, you told us from WHO that is 2025, you are going to close the envelope. Hello? Yes, you said you are going to close it. And there's a 20, where is it? I thought it was, you're going to close it. Our target is that we have to take that $20 million. We have to do everything to make sure that we take it, we meet the needs, we'll meet the criteria very, very quickly. Because if it's something that we've all said we want to do, then everybody must be on the same page. I want to commend a farmer and all the ladies that came forward transparently to show us those data. And what we need to do is we don't need to wait in October before we now cry hope. We need to be able to track this thing on a month-on-month, basis. So I want to thank all of you. I want to thank our partners, the World Health Organization, the World Bank, the National Malaria Elimination Program, our community pharmacists are here, all of our pharmaceutical associations are here. Thank you very much. Our various private and public hospitals, and all of you that are here for your invaluable support and making this initiative positive. Of course, permit me to thank in absentia our very hardworking Honourable Minister of Health and Social Welfare, Professor Mohammed Ali Pate. Our best regards, our best wishes to him. We know all of the things that he has brought about in his tenure as the Honourable Minister of Health. Wish him well. We are also tracking and monitoring, all of his deliverables, so that we can say at the end of the day, in your time, you did all of this. And to also thank the Honourable Minister of State for cooperating and operations with your Honourable Minister. We believe that if you do all of these things and you do them well, your time, will be your time in that ministry will be written in gold, and Nigerians will forever be grateful, because we know that you are pushing everything to ensure that we save over 1 million lives, and you are doing so many things, so many big health initiatives. and want to wish you well. To Dr. Diop, our country director for the World Bank, thank you for your invaluable support at all times, your funding, your technical assistance. We believe it will continue to catalyze our health initiative. To our country director on the Bill and Melinda Gates Foundation, Mr. Uche, whose organization's investment has been pivotal to malaria control, we say a big thank you. Dr. Walter, our our WHO country representative, we believe that your expertise and your advocacy capacity has helped also to push this forward. Thank you very, very much. To all of our partners, Marshall who I met last week, I did promise, I said I'll be here in person. And to all of our other partners, please, let's see this as a start work. It's only when we achieve what we have set for ourselves that we have done the job. They don't pay people for attempts. They pay people for results. And it's the result that is important. It's the result that takes us to that final breaking point in which we all can say that, yes, we've done our best, we've contributed what we needed, and we've seen the results. I believe that we have everything to make it work. We believe we have all it takes to eliminate, malaria completely in Lagos State. I want to congratulate our own Ministry of Health. Congratulating ourselves is telling you that you have a lot more to do, Prof, and all of you. But I will be watching, and I will do everything to continue to encourage you. And as a demonstration of that encouragement, I was whispering to Prof that I will also do something different. I will be promoting Dr. Idowu as a permanent secretary in Afama. Don't worry, she doesn't even need to be here. You should have kept the clap. No. You don't know what you have done for her. By clapping means that she's going to work twice as much. She's going to work twice as fast. She's going to work twice as better. So I wish her all the very best in this hard work she'll be doing. To my fellow Lagosians, the fight belongs to each of us. Let us embrace a preventive measure like eliminating mosquitoes, adapt a test before treatment. And I think that is a message we need to take away. All of our pharmaceutical establishment ensure that we can pass this message. Test before treatment. It is so important that we do not just take this for granted. Let us ensure that we can take this advocacy into our communities, into our nooks and crannies, and show really that once we have started this campaign in Lagos, it will go around every part of the city. We can rewrite the history of malaria in Lagos, and it is in our hand. It's all of us in this room that can help do that. I want to wish you all the very best, and I believe that when we work together, there's absolutely nothing that we cannot achieve together. Thank you very much.
Mr. Governor, sir, may I crave your indulgence for the formal launch of the malaria pre-elimination intervention in Lagos, and to the newest permanent secretary, congratulations. Congratulations, Dr. Idowu.
When they were doing interview, she thought I really didn't like her. She was frowning her face one day like this. She was looking at, she was doing her eye and her eye and her eye like this. But it's okay. Congratulations. I wish you all the very best. That's okay. Thank you.
Oh, yeah. Sir. Mr. Governor, sir, the unveiling, yes, sir, it's remote. We have a remote that you can use. You can.
Please be seated. Honourable Minister, please join us. Thank you. Our World Bank and WHO representative. Let's just move. It's Honourable Minister. Abi, yes, please come. It is therefore my honor to formally unveil this pre-elimination launch of malaria from Lagos State Thank you. The Pathway to Malaria Pre-Elimination and Digitalization Program in Lagos. Thank you very much. Thank you.
Mr. Governor, sir, may I crave your indulgence to quickly invite this Honourable Commissioner for Health, Special Advisor on Health and Permanent Secretary, Ministry of Health, to join you for the first photo hub. After them, we'll be inviting ESCO members that are here, members of the State Executive Council, to take their turn. ESCO members, please join them. Next.
Ladies and gentlemen, as soon as the EXCO members are done, we'll be welcoming the representatives of the Society for Family Health, Pharmacy Council of Nigeria, and the CEO RBM Partnership to End Malaria. Thank you very much.
National coordinators and yeah, all covered, don't worry.
Ladies and gentlemen, we are welcoming the directors that came with the Honourable Minister of State for Health from Abuja. They would also be taking a picture with the Governor and the Honourable Minister. Thereafter, we will welcome all the permanent secretaries present. All the directors from the Federal Ministry of Health, please, you are joining the Honourable Minister and our dear Executive Governor. And as soon as we are done, we'll welcome all the partners, World Bank, all the partners, World Bank, World Health Organization, MyShemed, Society for Family Health, Pharmacy Council of Nigeria, and RBM Partnership to End Malaria. As soon as we are done with this picture session with the partners, we'll welcome all the directors from the Federal Ministry of Health. Immediately after the partners, we are welcoming all the permanent secretaries in Lagos State, including the newly appointed permanent secretary, Dr. Idowu. And as soon as we are done, also we are inviting all the permanent secretaries in Lagos State to join the Executive Governor and the Minister of Health for State for Health, Dr. Ishiak Salako. All the permanent secretaries in Lagos State, it's time for you to take a picture now with the Governor and the Honourable Minister. All the permanent secretaries in Lagos State. As soon as they are done, ladies and gentlemen, we welcome all the directors from the Federal Ministry of Health. All the directors that have accompanied the Minister of State for Health, all the directors and the Federal Ministry of Health are coming after this picture session. Thank you very much. Ladies and gentlemen, we want to specially welcome the Permanent Secretary, Lagos State Ministry of Health, Dr. Olusola, for the vote of thanks and closing remarks. Thank you very much.
Okay. Our malaria negative governor of Lagos State, who has had to leave very quickly, the Honourable Minister of State for Health, Dr. Isiaq Salako, the members of the body of permanent secretaries, including and especially Dr. Idowu, our development partners, particularly the World Bank, and our guest commissioner from Ogun State, Dr. Tomi Koka, all other distinguished guests who are here today. We thank you for being part of this program, and we ask that you all just become advocates for this pre-elimination program. Just let's spread the word about making sure we get tested before we get treated. Thank you very much.
Thank you very much, Dr. Ogoye. Ladies and gentlemen, we've come to the end of this event. However, we still have the lunch and networking session, and we are going to move upstairs for lunch. We want to specially request that our Honourable Minister, all the permanent secretaries, Commissioner for Health in Lagos State, the Special Advisor for Health to the Governor of Lagos, we are all moving to the right-hand side of the topmost floor. To the right-hand side where I'm pointing to, that's where our special guests are going to move to. The Honourable Minister, the Commissioner for Health, the Special Advisor for Health to the Governor of Lagos State, all the permanent secretaries and directors are all coming to my right-hand side where I'm pointing my hands to. Our dear partners, our goodwill message presenters, we're all coming to the right-hand side where I'm pointing to, while every other person here seated will be moving up for our lunch and networking session. Please, you're advised to kindly meet with those that you see, discuss with them, network with them, while you also keep an eye on your personal belongings. Thank you very much, distinguished ladies and gentlemen. My name is Abiodun. On behalf of the Honourable Commissioner, Professor Akin Abayomi, we appreciate us all. Thank you, and have a good afternoon.
tó bá dúró kò ṣọ́ra kò ní hardline Eko gbàgbẹ̀rẹ̀